case is different.
More recently, a number of shortened versions of psychological therapy have been developed. Some examples are behavior therapy, cognitive therapy, and cognitive behavioral therapy. Behavior is actions. Cognition is knowing and judging. Some patients in therapy want to learn to find satisfaction in what they do. Others want to unlearn behaviors that only add to their problems. In these therapies, patients might talk with a therapist about the past, or patients might be advised to think less about the past and more about the present and the future.
Other kinds of therapy involve movement, dance, art, music, or play. These are used to help patients who have trouble talking about their emotions. In many cases, therapy today costs less than it used to, but the length of treatment depends on the problem. Some therapies, for example, call for 20 or 30 visits with a therapist. How long people continue their therapy can also depend on the cost. People find that health insurance plans are often more willing to pay for short-term therapies than for longer-term treatments.
Mental health experts say therapy can often help patients suffering from depression, severe stress, or other conditions. For some patients, they say, a combination of talk therapy and medication works best. There are many different drugs for depression, anxiety, and other mental and emotional disorders. Critics, however, say doctors are sometimes too quick to give medicine instead of more time for talk therapy. Again, cost pressures are often blamed. Mental health problems can affect work, school, marriage, and life in general. Yet they often go untreated. In many cases, people do not want others to know they have a problem.
Mental disorders are common in all countries. The World Health Organization says hundreds of millions of people throughout the world are affected by mental, behavioral, neurological, or substance use disorders. The WHO says these disorders have major economic and social costs. Yet governments face difficult choices about health care spending. The WHO says most poor countries spend less than 1% of their health budgets on mental health. There are treatments for most conditions. Still, the WHO says there are two major barriers. One is lack of recognition of the seriousness of the problem. The other is lack of understanding of the services that exist.
The father of psychoanalysis, Sigmund Freud, left Vienna soon after troops from Nazi Germany entered Austria in 1938. The Nazis had a plan to kill all the Jews of Europe, but they permitted Freud to go to England. His four sisters remained in Vienna and were all killed in Nazi concentration camps. Freud was 83 years old when he died of cancer in London on September 23, 1939. Anna Freud, the youngest of his 6 children, became a noted psychoanalyst herself. Before Sigmund Freud, no modern scientist had looked so deeply into the human mind.
Science in the News was written and produced by Brianna Blake. I'm Faith Lapidus.
And I'm Bob Doty. You can download transcripts and audio archives of our programs at voaspecialenglish.com. Listen again next week for more news about science in Special English on the Voice of America.